This episode of the ABMP Podcast is sponsored by Pain in the App, mobile app by Dr. Ben Benjamin. Pain in the App is a new mobile app to learn about the injury process from head to toe. Quiz yourself on the theory behind why injuries happen and what we can do about it. Dig into how specific treatments work and why. Get started on Pain in the App with dozens of free questions, then get hundreds more for only $9.99. But be careful. It's addictive. Go to the App Store or Google Play and search for Pain in the App. ABMP members get 20% off the list price on all Handspring Publishing titles, including Musculoskeletal Pain, Assessment, Prediction, and Treatment by David Walton and James Elliott. Visit handspringpublishing.com to learn about these and other books. ABMP members visit abmp.com/discounts to access your discount code and save 20% on all list prices with free shipping to US and UK addresses. Find your next favorite book at handspringpublishing.com.
I'm Darren Buford.
And I'm Kristin Coverley.
And welcome to the ABMP Podcast, a podcast where we speak with the massage and bodywork profession. Our guest today is Dr. Ben Benjamin. Dr. Benjamin has done pioneering work in the areas of ethics, communication, and sexual assault prevention, writing articles on professional, sexual, and business ethics. He is the co-author of The Ethics of Touch, a textbook used in schools throughout North America to teach ethics and boundaries to massage therapists as well as other hands-on healthcare professionals. He has been an expert witness in the cases of sexual assault in the massage and bodywork field since 2004. In 1974, Dr. Benjamin founded the Muscular Therapy Institute, a school he owned and nurtured for over 30 years. In the 1980s, he developed a 150-hour curriculum in ethics and communication skills for therapists in training. He has taught courses in ethics, boundaries, sexuality, and communication to somatic therapists for over 30 years. Additionally, Dr. Benjamin earned a PhD in sports medicine and has dedicated his life to helping people cope with and overcome the pain and stress caused by injury to the body in his muscular therapy sports injury private practice since 1963. For more information, visit benjamininstitute.com. Hello, Ben, and hello, Kristin.
Hi there.
Hello, and welcome back to the ABMP Podcast. We're so excited to have you back today. We are talking about Keeping Clients Safe Part 2. It's the second article in a 3-article series you did for Massage and Bodywork magazine. This Part 2 was subtitled How to Avoid Violating Client Boundaries. Such an important topic. Let's jump right in, right with the subtitle. Dr. Ben, how do you avoid violating client boundaries?
Well, I would say something like this instead. Sort of avoiding violating client boundaries requires a complex and multi-layered approach. So let's start with this. Ask questions before you begin each session, even with regularly returning clients. First, you would ask what the client wants. You might say, where would you like me to work today? Or is there anywhere you would like me to focus in today's session? Is there anywhere you don't want me to work today? Additionally, when checking in with regular clients, be sure to ask, is anything different since the last time I saw you? These answers are the beginning of boundary setting, with clients.
Ben, isn't the therapist usually in charge of the session?
No, I think that the client is ultimately the one in charge. At any point during the session, clients have the right to tell you to stop a particular technique, sort of revisit an area where they would like more attention paid, or adjust the level of pressure, reminding the client that they always have agency over their own body reaffirms your commitment to respecting their boundaries and increases their sense of safety and trust. And honoring this integral part and aspect of the client-therapist relationship requires that you let go of your ego and any false notions of control. Most clients know what they would like and they know what they want and will communicate it clearly when given a chance. Still, always use your common sense. And of course, always avoid inappropriate touch that might cross the boundary.
Absolutely. Question then, who sets boundaries? So is it the client or therapist setting the boundaries? And what boundaries are they setting?
So the therapist, must first make certain boundaries clear to the client. And the client also participates in the boundary setting as well. Let me define what I mean by boundaries first, because it's an amorphous kind of concept for many people. Some types of boundaries are very simple and clear cut. For instance, all competent surveyors of land, could agree that where to draw the line, a boundary line that separates two properties, one neighbor from the other. That's pretty clear. Unfortunately, that kind of simplicity and clarity doesn't really exist in the relationship between people. So in interpersonal relationships, a boundary is really a limit that separates one person from another, or it protects the integrity of each person. A boundary can be as literal as the skin that surrounds our body, or as figurative as an attitude. The primary problem in defining boundaries is that in most instances, they can't really be seen. It's an elusive yet personally palpable line that distinguishes us from everything and everyone around us. It defines our personal space, the area we occupy, which we appropriately feel is under our control. So we all know the experience of having somebody really stand too close to you or to touch you without our permission. And what that person has done, knowingly or not, is invade our space and cross our boundary. And boundaries are not only physical, but include our emotions and thoughts as well. In a real sense, boundaries afford us a sense of safety and protection. They are a sense of how close or far away we want people to be from us, both physically and emotionally. Often we're unaware of our boundaries unless they're threatened or crossed. Boundaries are both very individual and dependent on the context that we're in. They're also idiosyncratic in that they're very different for everyone.
And Ben, do a person's boundaries change?
Yeah, boundaries change with the situation that you're in. I mean, they can become more fluid or rigid depending on the context, even with the same person. And each of us faces many boundary decisions each day. Who do I greet with a smile or a handshake? Or who do I hug? Who do I kiss? What information about myself do I disclose? And to who do I disclose it? Which people? With whom do I cry when I'm sad or vent my emotions when I'm mad? To make things even more confusing, boundaries between any two people fluctuate a lot. Boundaries that's deemed appropriate at one time may be highly offensive in another context with the same person. For example, some people who like to be affectionate in private are very uncomfortable with any public displays of any affection. Although some interpersonal boundaries are fairly stable, others require ongoing sensitivity to changes in the time, place, and emotional state.
I'm curious then, if we've got boundaries that are fluctuating from person to person and setting to setting, how does that play out in a massage setting?
Well, boundary issues between a practitioner and a client are especially sensitive. Helping relationships often require the client to make an unusual boundary adjustment. For example, in very few settings other than healthcare, are people expected to take off their clothes shortly after meeting somebody? Then they permit the practitioner to touch them, tell the practitioner aspects of their life history or their medical history that they haven't told anyone else, or allow practitioners to manipulate their muscles and bones in ways that are maybe a little bit uncomfortable. Now, the healthcare practitioner is used to these types of boundary adjustments. For the client, though, this may be an unusual or stressful experience, especially when it's a client who hasn't had a lot of work done with their body. And in this uncharted territory, clients may not be aware of their own needs or their own options or what appropriate behavior is because those boundaries haven't been tested before.
So Ben, that brings about an interesting question. Why is it important for massage therapists to understand the power differential?
It's difficult to talk about boundary issues between client and therapist without understanding something about the dynamics of power, in a therapeutic helping relationship. Now, there's a natural power differential in many relationships. For example, a parent and a child, or between a teacher and a student, or an employer and employee, and of course, between healthcare practitioner and client. In these examples, the parent, teacher, employer, healthcare provider are in a more powerful position. They are the authority figures whose actions, by virtue of their role, before the person even walks in, directly affect the well-being of the other person. They know that. They're expecting a certain kind of behavior or attitude. The child, the student, the employee, and the client are in a vulnerable position when they come for a session with a massage person. In theory and in ethical practice, the power differential exists for the purpose of bringing benefit to these more vulnerable individuals. For example, the child's well-being should be enhanced by the parent's care. The employee should benefit by the employer's management. And in this situation, in all these situations, and especially in a bodywork situation, the potential for some kind of abuse exists. The authority figure may take advantage of the other person in many ways, physically, emotionally, financially, sexually, or professionally.
Ben, why is this so important in the field of bodywork?
Well, in the massage and bodywork field, the power differential is amplified by the physical touch aspects of the profession. The client takes a position, usually lying down or sitting, in which she or he allows the practitioner access to his or her body. The practitioner positions themselves within the client's physical space, often leaning over the client. In many modalities, the clients are unclothed and draped. The psychological effect of being unclothed for a client with a clothed practitioner increases the imbalance of power right there. And finally, as the practitioner's hands make contact with the client's body, the client's physical safety is literally in the therapist's hands. The power differential in a relationship such as this requires us to consider two questions. The first question seems pretty obvious. How is the person with power handling that power? The person who holds the power in the relationship can easily be tempted to misuse the power. Having power offers the therapist a chance to get something that they want at the expense of the other. And to maintain an ethical practice, the person in power must regularly say no to something that they could easily get and must instead choose to pay special attention to the needs of the person with less power. The therapist must consciously decide to maintain the integrity of the client's boundaries in this situation, where the client has significantly relaxed those boundaries. Even if the client is willing to relax those boundaries, you still have to maintain the boundaries.
And Ben, what's the second question?
The second question to consider is not so obvious. How is the person with less power responding to the other's use of power? Because of the explicit power dynamics in professional helping relationships, whenever a therapist crosses a client's boundary in any way, it's more serious than in everyday intrusions with a co-equal person or with a peer. Clients must put enormous trust in therapists of any kind and usually feel less powerful than the therapist. So the answer to the second question may be difficult to determine. The increased perception of the power differential in a bodywork session puts the client in a highly vulnerable position. Because of this, the client usually feels less free to defend themselves against intrusions or to question unexpected behavior by the therapist. In some cases, the client may feel uncomfortable about raising any concerns, complaining about something in the treatment, or making requests of the therapist. In other cases, it will be difficult for the client to say no or to question the practitioner's behavior, even if the client feels uncomfortable or mistreated. The client may even refrain from communicating anything that could possibly be construed negatively for fear of reprisal or loss of the relationship. And this is particularly obvious when somebody is in a situation of sexual assault where things start to happen and they freeze and they can't say anything, or there's something that's subtle that happens and they say, oh, they're just imagining things. It's because of power differential, people lose the sense of their own agency and power.
Let's take a short break to hear a word from our sponsors.
Anatomy Trains is delighted to invite you to our in-person fascial dissection workshop, May 30th through June 3rd, 2022. We're excited to be back in the lab with Anatomy Trains author Tom Myers and master dissector Todd Garcia in Todd's Laboratory of Anatomical Enlightenment in Boulder, Colorado. Join students from around the world and from all types of manual, movement, and fitness professions to explore the real human form, not the images you get from books. Visit anatomytrains.com for details. Universal Companies knows you're busy. So stop searching around and get all of your massage and bodywork products, supplies, equipment, and education in one place. Universal Companies. With 40 years of experience and professionals like you on staff, you can trust your needs will be met. Explore the website and go to universalcompanies.com/ABMP for a special discount just for ABMP podcast listeners. That's universalcompanies.com/ABMP.
Now let's get back to the podcast.
Let's switch a little bit, talk about responsibility for setting boundaries. Should the setting and maintaining of boundaries be a shared responsibility between the client and the therapist?
No, I don't think so. It's the professional's responsibility to be aware of how the power differential may be affecting the client's ability to raise any concerns. The professional, not the client, has ultimate responsibility for ensuring that the therapeutic encounter works for the client's benefit. In most cases, the therapist behaves responsibly, respecting the client's boundaries. However, in at least 1,000 cases per year in the United States alone, a client is sexually assaulted by a massage therapist. And that's a conservative estimate because according to most recent studies, more than 60% of any type of sexual assault goes unreported. And as a result, the client's life, if that happens, is irrevocably damaged for years to come and maybe for the rest of their life. The abuse can have broad, sweeping consequences from negatively impacting the person's sexual contact with their partner or making it unlikely that the majority of these people will ever receive a massage again. It is vital to realize that even though therapists may be doing their best to foster an atmosphere of equality, the power differential will always exist on some level in the therapeutic relationship.
So, Ben, what can be done?
Well, the growing trend in the medical world is to encourage patients to take an active role in the decision-making process of their healthcare. This is one way that most massage therapists, body workers can interact with their clients. Getting the clients to take responsibility, not always so easy. Unfortunately, it's difficult to reprogram a lifetime of doctor knows best or therapist knows best. That's a very prevalent belief. And due to the inherent power differential, many clients have difficulty speaking up during a session when their expectations are not being met or they feel disappointed or they don't like what's happening in the session. A client may fall silent or worse, they're just never going to return without explanation. So you don't know what happened. In creating an atmosphere of ease and safety, remind clients that an open dialogue is welcome. Begin to cultivate this awareness during your intake by saying something like, feel free to let me know if at any point you don't like something or you feel uncomfortable. If you notice an internal dialogue that questions what's happening in the session, it's time to say something. And remember, it's your session, not mine, and I'm happy to listen and change what I'm doing. This really invites the person to be honest and to talk to you. A client's comfort level in communicating openly with a therapist will vary based on their family background, their social, cultural, or religious history as well.
Ben, what are some examples of best practices?
Well, it's important for therapists to be clear about disrobing, draping, areas of the body that are and are not appropriate to work on.
Ben, is it important for clients to remove all of their clothes to get a massage?
No, I don't think so. The most important thing is that the clients feel safe and comfortable. And in the massage industry, the stock phrase, undress to your level of comfort, is used frequently, but is not totally clear to a person receiving the massage, for the first time especially, or receiving a different type of body work. I think it's important to follow up this statement with examples. Some people choose to leave on their underwear. Others remove everything. Some people like to only take off their socks or the top and leave the rest of their clothes on. What's important is that you feel comfortable. Do whatever makes you feel comfortable, and I can work around that. So when you set clear boundaries, you are again increasing the client's sense of safety and comfort. It's especially important to have this conversation with a first-time client because it normalizes their choice with regard to disrobing. Now, some people feel it's expected to remove all of their clothing, and if they don't, it will impact the session and they will be viewed kind of negatively by the therapist. After all of the sexual and physical trauma people, especially women, experience in our society, Safety and trust can only be facilitated when the client is free to make choices without judgment. And of course, always have the client change in private with the door closed or a curtain drawn, depending on the situation. And do this even if the client, says they don't need privacy. Some clients will just walk in and start undressing without you saying anything. You want to stop them, while you gather whatever information that you need before the session starts and let them know that you're going to be leaving the room, at which point they can change and get ready. And this establishes, again, another professional boundary for them if they didn't know it.
Okay, let's talk about draping. Let's hope everyone listening is on board and agrees that draping is important. But Dr. Ben, can you tell us a little bit more about why is good draping technique important?
Well, draping sets a boundary, where the therapist is going to work and where the therapist will not work. Secure draping is an important part of establishing safety. Sloppy or loose draping only makes the client feel uncomfortable and may create unnecessary issues for the therapist. As most clients are naked or almost naked on your table, they have to feel confident that the drape will not slip, fall off, or be compromised in some way. Their confidence level rises when the drape is positioned professionally. This means the drape is secure in the right place and only exposes the area on which you're going to be currently working, and never work under the drape. This violates the implicit agreed upon boundary.
Ben, is working on the buttock common in massage? And is it an important part of the body to work on?
Well, explicit permission from the client is necessary before engaging in work on the buttock region, especially in the middle or lower buttock. And most spas have restrictions on working in this area. And usually in private practice, there isn't. In some spas, they don't permit therapists to work on the gluteus muscles at all, while others have therapists work only on the superior part of the buttock or only on top of the drape, through the drape, never touching the skin. Conversely, many therapists who have an independent private practice do work on the buttock area. Now, if you work with clients who experience low back pain or hip pain, it can be an important area to treat if done appropriately. And there are important ligaments that are located in the medial superior border of the gluteus muscles, and others that are deep in the gluteus, under the gluteus muscles, in the central portion of the buttock. The gluteal cleft is the groove between the buttocks that runs just below the sacrum and coccyx to the perineum. And if you work on the gluteus muscles, always drape the buttock on one side at a time and keeping the gluteal cleft covered. Never place your fingers into the gluteal cleft. In a relaxation massage, never work on the buttock area without explicit permission from the client, because this is a very personal area of the body. If a person comes in and they're coming to you because you work with injuries and they point to their buttock, they of course know that's where you're going to work. But if you're just having a relaxation massage, in our society is a fairly disturbed one around the body and around sexuality. And when somebody works on a buttock area, they could stray into areas you don't want them in, and it could be not a good situation. But if it's in a therapeutic bodywork, it's usually an important place to work if you're working on someone who has some kind of pain or something like that.
Let's talk about a neighboring region of the body, the inner upper thigh. Is it true that there's some ambiguity about working on that area?
Well, the inner upper thigh is a very personal and sensitive area as well. It's often associated with touching only in an intimate sexual relationship. Therefore, practitioners giving a relaxation massage should only work on the inner upper thigh at least 3 to 4 inches down from the groin. And that's what I always train people to do. And that's what I suggest. And there are exceptions, of course. An injury to an adductor muscle at the tendon attachment to the upper inner thigh, like the gracilis, if a client is coming in and that's the kind of work you do and that's what you're trained in and requests treatment, that's what you do. But only by a therapist who's trained in that, not somebody who just, is messing around, because they think they know how to do it. That's a very particular type of treatment. And in this type of session, you have to be able to assess what's really going on, because you can have a referred pain to the groin from a ligament in your back. So you have to be clear about what you're doing before you enter into, doing something therapeutic, like the attachment of the gracilis muscle is like an inch from the genital. So you want to know what you're doing. And that's not some place that you just massage normally. And the therapist has to be skilled, in doing that kind of work. And there are also a number of gynecological or urological issues that would refer pain as well to the upper inner thigh that are really beyond the scope of massage therapists. And unless there is a specific injury or pain to address and the therapist has that training and skill to address it, I recommend avoiding anything in the upper inner thigh 3 or 4 inches from the genital region. And working on the inner upper thigh is really not necessary in a relaxation massage. And often it makes a client, the majority of clients, kind of tighten up. Working in this area is often the way a therapist who is a sexual predator tests the client's boundaries before becoming sexually inappropriate. For your listeners, I just want to give a warning that I'm going to give you a kind of a graphic example. Now, sometimes a therapist's fingers, usually a male therapist, will make occasional or so-called accidental contact with a woman's underpants or labia. And a therapist's fingers should never come in contact with the genital region. There's absolutely no reason for that to ever happen, especially in a relaxation massage, even in an injury massage, if you know what you're doing. I've been doing this for 59 years and it has never happened. So it usually is either a sloppy person or a person who has a sexual intent.
Ben, let me ask you about the abdomen. Do therapists regularly include working on the abdomen in a massage?
Well, the abdomen is also a sensitive area for the majority of people that I've ever seen. Many emotions and feelings are held in this part of the body. And working on the abdomen is often also a gateway, along with the inner upper thigh and the pectoral muscles, by therapists with sexual predatory tendencies. These therapists are often testing how far they can go without meeting resistance. Therefore, some of the larger spa companies prohibit any work on the abdominal muscles. Additionally, launching into work on the abdominal region without specific permission and request can kind of be scary or unsafe for the client. There are certain instances where abdominal work can be very useful. For example, working through the abdomen on the psoas muscle, the attachment to the spine, that can be very therapeutic if you know what you're doing. Also treating rectus abdominis muscle strains, which I'm doing with a client right now. Working on menstrual pain or alleviating constipation issues. Also, visceral manipulation techniques can be very effective if the therapist has the appropriate training. Above all, abdominal work should only be performed with explicit permission and consent from the client, and only with the therapists who have the appropriate training to do that kind of work. But in a regular relaxation massage, I don't think it's a good idea to include it, and most spas don't recommend it.
Let's move up the body a little bit more. How about working on the pectoral muscles?
Working the pectoral muscles on a female client, particularly in the United States, can also be problematic. As an expert witness, I've seen so many cases of sexual assault in a massage setting that start with the therapist working on the upper pectoral muscles and drifting into the breast and beyond. In the over-sexualized cultural context in the United States, massage of the breast tissue is not recommended. In most states, in fact, massage of the breast is illegal. I would only work on the upper pectoral muscles if the client requested it, and only if there was a good reason to include it. Now, in certain provinces in Canada, breast massage is an accepted technique. Now, in these massage programs, they have at least 2,400 hours of training or more, and breast massage is taught and often performed on clients, where there is a good, reason for it. These provinces have regulations that are clear and strict. For instance, the client must consent in writing each time a breast massage is performed. Women with certain conditions can definitely benefit from pectoral work, and in some cases near or under the breast tissue. Cases of clogged milk ducts in nursing mothers is one example. Painful surgical scarring on the breast from cancer surgeries or other surgeries. And an intercostal or lower pectoral muscle strains are instances where manipulation of the muscles and some kind of therapeutic work can be very effective. In the United States, I suggest 2 ways of working on the pectoral muscles of a female client. One, carefully undrape one side of the chest with only the very upper pectoral muscles undraped on one side. work the upper segment of the muscle, then redrape the client, then redrape the client and undrape the other side to continue the work on the other side, and never work under the drape and never work on the breast. So 2, you could work through the sheet or a towel on the, not on the skin, and do, very high up just under the clavicle, using maybe small circular motions or pressure point kind of work on the pectoral muscle with moderate pressure. So in my opinion, if we lived in a different, more evolved time, it would be acceptable and beneficial to work on parts of breast tissue in certain instances, but not in the current social climate in the United States or in most of the world. It's just not a good idea.
And Ben, as we bring the podcast to a close, is there anything else you'd like to add?
Yeah, always treat the person and their body with sensitivity and respect. Always ask permission and be especially aware and careful when you work on more sensitive and personal areas of the body, like the upper chest or the buttock muscles. Provide a space that upholds the client's safety, that's predictable, and cultivate trust by maintaining boundaries that are very clear. Remember, trust takes time to build and can be destroyed in seconds. If you follow these guidelines, you'll protect not only yourself and your clients, but also your employer and the massage industry as a whole.
We want to thank our guest today, Dr. Ben Benjamin. To find out more information about Ben, visit benjamininstitute.com. Thanks, Ben, and thanks, Kristin.
Thank you.
Ben, thanks so much for that really important conversation about boundaries. Join us at the free ABMP CE Summit on Monday, March 21st. This one-day online conference focuses on fascia and takes learners on a journey from understanding fascia, what it looks like, its role in the body in different types, to working with it using multiple modalities and techniques. Instructors include keynote presenter Dr. Robert Schleip and CE course instructors Rochelle Clausen, Allison Denny, Joy Edwards, Gil Headley, David Lazondak, Whitney Lowe, Till Luca, and Kathy Ryan. This event and 4 hours of CE is free for everyone in the profession. Visit abmp.com/summit to learn more and register today.